The following film you're about to see is to inform you about palliative radiation therapy, to assist you in making decisions about your cancer treatment that are best suited to you.
Radiation therapy has been recommended for you to ease or prevent development of symptoms related to your cancer. In this film, we will explain what it means to have palliative radiation therapy. You will see the 4 steps of radiation therapy, which are simulation, treatment planning, verification films and treatment, and after treatment. When radiation treatment is given to ease symptoms, it is called palliative radiation therapy. Palliation means to relieve symptoms without necessarily curing the disease. Palliative radiation therapy is used very often to relieve or prevent symptoms related to cancer. In fact, about half of all people who have radiation treatments for cancer receive it to palliate symptoms. There are a few important differences between having radiation to cure cancer and having radiation for palliation. When radiation is used for palliation, the treatment is generally not as intense, takes less time, and has overall fewer side effects. The first step in radiation treatment is the simulation. The simulation area is where your radiation oncologist begins planning your treatment. This is the simulation room. You'll lie down on a table like this one while the radiation therapists do a quick CT scan of the part of your body that will be treated. In some cases, a mask will be made that molds perfectly on your face, or a plastic foam cradle might be created around you. A simulation therapist will place tiny permanent tattoo marks around the part of your body to be treated. The tattoos are about the size of a small freckle. If the part of your body to be treated is your brain, then the simulation therapist will make the necessary markings on your mask itself, and you will not need any tattoos. The mask, mold, and tattoo marks are important parts of your simulation. These things are used to help keep your head or body as still as possible and in the same position every day while you are getting the treatments, so we can be sure that the radiation is reaching the exact spot it should every time. If you think you might have trouble with the mask or body mold because tight spaces frighten you, or you are worried about lying down on a hard surface because of pain, just tell your doctor. There are medications that we can give you or other things we can do to make the simulation process easier for you. The second step is treatment planning. Your radiation oncologist looks very carefully at your simulation CT scan and works with other members of our team to create a unique radiation treatment plan that's right for you. Your radiation doctors might ask you some questions to help guide them, such as whether you've had radiation before. Treatment planning is a very technical process, so it takes a few days to finish. Your treatment will begin after the plan is finished and approved by the radiation oncologist. The third step is verification films and treatment. Getting verification films is like having a dress rehearsal before your actual radiation treatments begin. In the treatment area, you will come on your first day and get positioned in the same way you were during your simulation. The radiation therapists will use the tattoos to align you correctly and take X-ray pictures of you in your treatment position to make sure everything matches from the simulation day. This is done to ensure that all technical information about your treatment was transferred properly. This process takes about 45 minutes. If you are having radiation to the brain, the mask will ensure your head and neck stay still during each treatment. Your radiation oncologist will review these X-rays before you get your first treatment. You and your radiation oncologist will decide when you should start your treatment. After the verification films are checked by your doctor, you'll finally be ready to begin. Radiation is usually given in fractions. which means in small daily doses. A course of palliative radiation therapy is commonly 2 to 3 weeks. Since every plan is individualized, ask your doctor what duration of treatment he or she has recommended for you. Each session takes about 15 minutes, but the radiation beam is only on for just a few minutes and you won't feel anything. Your doctors and a radiation oncology nurse will see you at least once a week while you are on treatment to make sure you are doing well and address any concerns you may have. You can continue your usual daily activities as long as you feel comfortable doing these things. You do not need to limit contact with your family or friends. The type of radiation you are getting does not make you radioactive in any way. If you have any concerns about your treatment, even when it's finished, we are always able to help you. The fourth step is after treatment. Most people don't feel any effects of the radiation until their treatment is almost complete or it has been completed. They wonder if the radiation is even working. Yes, it is working, though it takes some time. You might feel fatigued during or after you finish your radiation. This is normal. It may take several weeks before you feel your energy has improved. There is one final point you should keep in mind as you consider radiation therapy. If your doctors feel you are ready, you may be discharged from the hospital during your radiation course. You can continue your treatments as an outpatient, but you cannot transfer your radiation to a different hospital midway through treatment. This is for your safety. If you need assistance with travel arrangements, our social workers or case managers may be able to help you.
In this video, you've learned about palliative radiation therapy, but that's just one way we can palliate your symptoms. Palliative care includes many different therapies that can improve your quality of life, physically, emotionally, and spiritually. You can receive palliative care at any point throughout the course of your illness and treatment, even while you're receiving chemo, surgery, and radiation therapy. Palliative care offers an extra layer of support to you and your loved ones while managing your symptoms. It is very important to understand that palliative care is not the same as hospice care. We have found that many people are confused about this difference. Hospice care is provided to patients when they are expected to live 6 months or less, whereas palliative care can be given as soon as someone is diagnosed with a potentially life-limiting illness. We are here to help you make palliative care decisions that are appropriate and customized for you. For more information or to arrange to see a palliative care specialist at Memorial Sloan-Kettering Cancer Center, ask your doctor or your nurse.
Hi, I'm Beryl McCormick, the Clinical Director of Radiation Oncology. The segments you have just finished watching illustrate the basic process involved when undergoing radiation therapy and some of the most common side effects. We treat hundreds of patients with palliative radiation therapy who have conditions similar to yours every year. As you have learned, palliative radiation is not meant to cure your cancer, but rather to relieve or prevent some symptoms related to cancer that might impair your quality of life. It is especially important to consider the benefits and the side effects of treatment when deciding whether radiation fits your individual needs. Treating cancer takes teamwork, and we work as part of your medical team to help you get through your treatment. The members of your team also include the other clinicians and nurses, your family and caregivers, and most importantly, you. A unique group of clinicians at Memorial Hospital specializes in palliative care medicine and can be additional members of your medical team to help you maintain your quality of life.